It could be the answer to carpal tunnel, numbness, and tingling in your hands and legs, and all kinds of neck and back pain. It's called cold laser therapy. It's a new technology, and joining us this morning to show us how it all works is Dr. Ashley Herfindahl with the San Diego Neck and Back Pain Relief Center, along with one of your patients, Paul Miller. Guys, thanks for being with us.
Thank you.
Thanks.
Nice to see you again, Greg.
Good to see you. All right, now tell us, what is cold laser therapy for people who may not know what it is? It's a new technology.
Yeah, what cold laser is, and we have the laser right here that I brought with me today. Cold laser therapy, easiest way to explain exactly what cold laser is a hot laser, which we're familiar with, like laser eye surgery, or for that matter, any kind of other surgery where they actually cut. Cold laser, there's no heating effect, so what we do is we send light energy in that tissue to allow that tissue to actually heal. With cold laser, when we're dealing as far as cold laser, is that we're actually able to heal the cell, the tissue. The patient doesn't feel anything whatsoever. And then what I'm going to do is, as far just to kind of demonstrate what cold laser does, is I have two different kind of probes here. And every single cell and every single tissue has its own frequency. And so with Paul, we're kind of setting up this as far as to do laser on his hand. And we had a lot of great success with Paul. And when I actually do cold laser therapy, we send that light energy in that tissue, allow the tissue to heal. In doing so, if it's multiple muscle cells, we increase in strength. If it's numbness or tingling, we're able to get rid of that. Also with cold laser therapy, it helps as far as with cell replication. Also as far as even helps, there's a lot of research with this type of cold laser, this exact same one, with burn victims as well. In regards to that. So
what's going on with the tissue? I mean, you know, we could talk a little bit about Paul's situation too, you know, in a second, but what's going on when most people come in, they have carpal tunnel, you know, maybe they have the numbness and tingling?
Sure. Well, what we're, in specific cold laser does is we send light energy in that tissue to allow that tissue to heal. So we're actually increasing oxygen in that tissue, increasing energy, which is a form of ATP. Also as far as cell replication, again, overall with muscles, we increase that muscle strength. And it's light energy, just for the same way when I explain to patients what cold laser therapy is, I explain it like this. What does a plant need to survive? It needs two things, water and sunlight. So this is light energy for the human body.
Okay. And Paul, we were talking just a few minutes ago, for 3 to 4 months, you were saying you had this knot, it was in your left arm, right?
It was underneath my left shoulder blade, and with that I had numbness down my left hand. And when I came across Dr. Herfindahl, he explained to me what my symptoms were, how we could correct it, and I don't know how this thing works, but it works like great. It's super.
And you were saying, so for 3 to 4 months, you had this knot on your shoulder that was causing the numbness and tingling.
Yeah, ever increasing, just like a knot of muscle. And through the adjustments, through the cold laser, after, I don't know, what, 2-3 months, the pain has subsided, and now it's totally gone.
Wow.
Now I'm just on a maintenance type program twice a month.
Yeah.
Come in for 15-20 minutes.
And what we do with cold laser, with particularly the numbness and tingling, we worked on the neck, as well as we actually worked as far as the nerves in the hand. And actually, realistically, with cold laser therapy, on the first visit with cold laser therapy, if we're dealing with tingling sensation or weakness, we're actually able to get rid of it. This same cold laser therapy is the same one they used on the Tour de France.
The same one used on Lance Armstrong?
On Lance Armstrong, correct. So this is what we have. Like, there's other laser out there, and people might hear about it or say, oh, I can go buy a laser. It's not the same thing. It's like, you know, you have that laser pointer. Well, that's a different kind of laser. But also it has to do with the wavelength and also the frequency, because every single cell, tissue, and organ has a different frequency. And I can program this from 1.0 to 10,000. There's no other laser that does this. And this is the one there's a lot of research on it. The first FDA-cleared laser. And like I said, Lance Armstrong used that in their Tour de France, and I was able to understand their protocols.
All right, now talk about the promotion that you have. You have a great promotion. Complete exam, x-rays if necessary, report of findings for just $39.
That's right. Yeah, what we're doing for the month of September, we're doing my initial consultation to see whether you're a candidate for my type of treatment, number one. We're doing orthopedic neurological evaluation, a chiropractic exam. We do x-rays, even if they're necessary, or if you bring your own x-rays that I need to look at. And also report of findings while I go over everything with you in detail to explain exactly, you know, if I can help you.
And the phone number is 619-295-3885 or SD neckandbackpain.com. Really quickly, we have about 30 seconds left.
Yep.
Talk about the types of treatments that the cold laser therapy can help, because there's a lot of people out there who
number one thing
have
is
numbness and tingling.
sure, numbness and tingling, carpal tunnel. This is for carpal tunnel. A lot of research with this laser on carpal tunnel. Knee pain, tendonitis, bursitis, severe pain, chronic or acute pain. I do a lot of patients with whiplash, and I do a lot of personal injury cases, and I'm actually able to help patients a lot quicker using this as far as cold laser therapy.
And you have a lot of people who come to you and say, gosh, I've tried everything, and then the cold laser therapy works.
That's right. That's right. I'll see a lot of patients that see other different kinds of problems.
All right, just like Paul. Guys, thanks for being with us, Dr. Ashley Herfindahl and Paul Miller.
Thank you.
Thanks so much
Glad
for being
you're
here.
feeling better.
I am. Thank you.
All right, and of course, for more information, go to our website, sandiego6.com. All right, let's go over to Brooke.